Hi everyone, how are you? Can you hear me? Groovy. Okay, so I have a few updates and then I'm going to hand it over to some other people on the call here. We're up to 4,130 cases since the start of the pandemic and 119 fatalities. We're continuing to see cases increase, and I don't think that's any surprise at this point that we're likely going to be headed towards that trajectory or continuing on that trajectory for quite some time. Our team is working to respond to this in a variety of different ways. I did want to highlight one thing that's important to note is that, as you'll recall, municipalities don't have the flexibility to tighten up in the ways that we did very early on in the pandemic, because the state has requires that or has sort of taken that authority. I have relayed our belief to the governor that we should tighten up more than we currently are in order to reduce people's opportunities to interact. And we suspect that, right now we're in phase 2.1, but we feel pretty strongly that we should be doing more to, I don't want to use the word lockdown, but make sure that we're reducing people's opportunities to interact. A few things I wanted to share, and one is the testing update and what we're doing to expand options for testing in the city. And so for that, I'm going to ask Dr. Vasquez to give a summary.
Thank you, Mayor Elicker. Good afternoon, everyone. So as Mayor Elicker mentioned, we are working to expand testing capacity with all of our community partners here in New Haven. Yesterday, we had a pop-up testing site at Columbus School in Fairhaven, where 328 people were able to come out and get tested. We also continue to work on capacity with our community partners. Cornell Scott Hill Health Center is adding some evening hours beginning tomorrow. On Tuesday and Thursday, they will have late hours through 7 p.m. at their Dixwell Avenue location. Fairhaven Community Health Clinic is looking to add some weekend testing sites. Our partners with Yale are adding some additional indoor pop-up testing sites. Currently on Mondays, they will be at the Boys and Girls Club, and on Fridays, they'll be at the Parish House at Betsy Ross. And the Friday following Thanksgiving, they'll be at Nathan Hale School. We're also working with Semaphore, who is able to provide some community pop-up testing, and we're finalizing 2 locations for this weekend, looking at the downtown area as well as the Beaver Hills and Edgewood areas for those test sites.
Thanks, Dr. Vasquez. Director Bond, do you have anything you want to share?
I do. I'm gonna share a few slides. So, but I also wanted to provide a brief update as one of the indicators as we're monitoring where we are with the resurgence are the hospitalization numbers. And currently we are seeing an increase of hospitalizations in our region, as well as ICU. As of yesterday, we had 159 inpatients, and we had 22 in ICU. And so we closely monitor this. It's really important indicator for us to know where we are in the sense of not just positive cases, but where our capacity is with response to those cases within the hospital. Other indicators that we monitor on a day-to-day basis are the school indicators. As you know, we want our schools to be open in a hybrid model eventually. But right now, the New Haven County are considered high risk in both indicators, looking at the positivity rate daily, and then also looking at the increases of hospitalization. So we will continue to monitor that. However, we, along with New Haven, Fairfield County and Hartford County are in the high risk category for both the indicators where we are tracking on school readiness and having to make decisions regarding reopening. We also track cases around our region, and the governor provides an update every single Thursday in regards to where we are as a city. And so I just wanted to remind all of our residents and community partners and surrounding communities that we are all in a risk category that's over 15 cases per 100,000. It's going to take a concerted effort for us to continue to work together on providing precautions and really ensuring that individuals are going to try to stay home and stay safe as much as possible and really only travel as much as necessary. It's really critical that we remind businesses that the executive order is in place and has been down to phase 2.1, which means that you have to close by 10 p.m. and have your kitchen closed by 9:30. And so we just want to make sure that that is in place and available to you. One of the things that I want to close out before I turn it back over to the mayor is that I did want to, let me just stop sharing here. I did want to indicate that, as you know, I was in quarantine for a period of 2 weeks due to a close family member testing positive. I have now had 3 family members that have tested positive, and it is really critical as we continue to see personal family members affected or even being exposed, the seriousness of this pandemic. And as we approach the holidays, I just want to implore you to please consider having your holidays with your immediate household members. Definitely, I urge you to get creative and have a Zoom Thanksgiving sharing of recipes or gathering of dinners through virtual platforms. We just want to try to ensure that we continue to be safe during this holiday season and consider ways how we can plan and modify the way we've been celebrating in the past so that we can reduce the risk and spread of COVID-19 and keep our friends, families, and communities healthy and safe. Unfortunately, as you know, as I indicated, the epidemic is worsening, and small household gatherings are an important contributor to the rise of our cases. And so we just want to implore you to take on this challenge with us and be able to uninvite any guests and try to celebrate with your close household members as much as possible. And with that, I turn it over back to the mayor. Thank you so much.
Thanks, Director Bond. As you may have heard, the state is promoting a Connecticut COVID alert program / app for smartphones. And Gage is going to share a little bit of how that works. We're encouraging city employees and all residents to use the app. The app is not useful unless many, many people decide to opt into it. And so with that, I'll turn it over to Gage.
Hey everybody, I just shared my screen on what that link will go to in the chat. Basically, if you have a Apple or Android phone, you will be able to anonymously let folks know if you've been tested positive for COVID, and this app will also let you know if you've been in close contact with that person. I think the important thing to know is that it's anonymous, and like the mayor had said, the more people that use this, the more people, or the more accurate it will be. So if you click on one of either of these things, there's a simple app in the Google Play Store for Android users to download. For iPhones, it's a little bit more tricky. You'll have to go to your settings in your phone, and you'll definitely need to have the most updated iOS software. But when you get into your settings, just go on the little search part. It's the easiest thing I've found, and type in exposure, and it should bring you to your exposure notifications. If you have the newest software, it should pop up and kind of look like this. And then once it's active, it'll show you what region you're in. I signed up a little while ago, and so far has not pinged me, so that's really, really good. But I encourage everyone else to use this, and the more we use it, the more we'll know. So
Gage,
that's the highlight.
can you share that screen again, that one that you just shared?
Yeah,
It's
what it looks like on the phone.
It's important for people to know that if the app doesn't automatically know, obviously, if you tested positive or not. So the share a COVID-19 diagnosis button there is very important. If people get a test back and it's positive, they should self-report to their iPhone or Android, and then that goes into the system to notify other people that you may have been in contact with recently, that someone they know and were in close contact with tested positive, and they should get checked out and potentially self-isolate as well. Thanks, Gage. I had one more thing before handing it over to questions. And that is that we sadly lost our our holiday tree last night. Obviously, we had pretty intense winds, and this is the view outside my window. The tree is buried. The base is buried, or was buried about 4 feet into the ground, and there were guy wires that were holding the tree in place, and several of the wires actually broke, and the tree came down. We're looking for a replacement tree. This tree was donated to the city from a individual or individuals in Cheshire, and the tree is damaged too much to be able to repair and put back up. And so we're looking for another option. But like many things in 2020, even though it may be fallen, it will rise again in a new form that is better than it was before. Do folks have any questions? Go ahead, Tom.
I only have questions about the Christmas trees. No, I'm just kidding.
Everyone else does. All the other media does.
Dr. Vasquez, you mentioned a group that's looking to host some testing pop-ups downtown Beaver Hills, Edgewood this weekend. I didn't catch the name of that group. What was it? Semaphore? Is that what you said?
Semaphore, yes. So it's SEMA and then the numeral 4. So they're actually one of the laboratory testing partners, but they can do start to finish specimen collection as well as processing those specimens. And they're a local company out of Brantford.
Thank you. And Mayor, what recommendations have you given the governor about how New Haven should be able to reduce people's opportunities to interact? Obviously, Philadelphia, Chicago, New Mexico, Oregon, a whole bunch of places are banning indoor dining or even doing stay-at-home orders. What is it you would like to see the city be able to do?
I think we need to work as a region. And I know the governor, and not just as a region like New Haven County or even the state of Connecticut, but with our partner states, because we're not an island, as is clear with the spread of the virus just about everywhere. So I made it clear to the governor's team that we would like to move back to some form of phase 1. I suspect that if they do so, they will alter slightly what phase 1 previously looked like, just because we're learning more things about what promotes the spread of the virus and what doesn't. But I think that the state needs to move back to tighten things up, particularly in the areas that we've seen a lot of the spread, which we don't have control over people's private gatherings necessarily, but we do have control over, for example, restaurant indoor dining, things like that.
I apologize if I forget if phase one included indoor dining or not, but do you think that indoor dining should not be allowed right now? Or would you discourage New Haveners from going indoors to dine?
I hate to say it because of our businesses, but I think that we need to be really smart and focus on, in the long term, making sure that we can open up. And so I would discourage people from going anywhere where they're maskless and interacting with other people, and that would include indoor dining.
And then Director Bond, if you have the numbers on hand, is there any kind of week-to-week comparison that you could give us about? I know Mayor Elicker gave the total number of cases in New Haven, but just as a reminder, in terms of how much has changed since this time last week or 2 weeks ago? Anything?
Hold on, I can pull it up. So you're asking what was the difference between last week and this week?
In new
For
cases
cases?
and hospitalizations or whatever you
Yes, so
have on hand.
for the past 2-week period, from November 2nd through November 15th, we've have 378 positive cases, which is projecting us to be at 21 per 100,000.
And do you have on hand the previous 2-week period? So 378 in the past 2 weeks. Do you know what the 2 weeks before that
So
were?
that would be, let me just put the date range in. Last. I don't have to play with the calendar. I can get that to you. Because I have to play with the calendar and it's freezing.
Is it possible to share a chart or anything like that?
Yeah, that's exactly what I'm doing. Hold on. Let me pull it up. Hold on.
Any other questions while she does that?
I have a question.
Go ahead, Mary, and then we'll go to Shana.
All right. When you talk about going back, no one should be indoors with people that are maskless. So is that the definition of indoor dining before we started to have iterations of phase one?
I don't think indoor dining was an option in phase one. Correct me if I'm wrong.
Right. So
Correct. It was not an option.
It was
And-
just takeout and delivery.
okay.
Curbside.
And that's basically what you prefer at this point.
Yeah, I think that we need to, given the explosion of cases, eliminate options for people to interact without masks with each other as much as we possibly can.
Okay.
So the week of 11/9 to 11/15, we were at 135. And then if we look 2 weeks before, it's bringing me back to the 278. It's just gonna add a week. We were at 278 about 2 weeks ago, so I gotta look at the difference between increase. I know that we had an increase there, but the table is not letting me.
Maybe, Marissa, you could.
I'll
play
get it
around
to
with
you.
and if you get something good, you can give it to Tom afterwards.
Yeah, I'll email
Yeah,
it to you.
I'd love to see it too. If you can
Yeah, I can
just-
send it to the group.
I think
Thanks.
just to clarify, because I think this is a really, really hard thing for businesses. The tightening up again, that the reason that Connecticut was, I believe, the reason that Connecticut was so successful at controlling our cases throughout the summer and significantly or quickly reducing the number of new cases in the first surge of cases was because we tightened up significantly and early. And that helped our businesses over the summer. And so I think we need to do the same thing now to be very proactive so that we can help our businesses in the long run. And I know this is not easy for businesses to deal with by any means, especially now when there's not the kind of federal help that we saw early on in the pandemic. But if we just keep going business as usual, or even business as unusual, but it's been that way for a long time. If we keep going in the trajectory we're going on right now, we're going to have way more cases, and eventually we're going to have to shut down anyways. We might as well be proactive and do it early so that we can open up early again.
All right. So are you getting feedback from the governor, or are you just, I mean, he knows your feelings already, I guess, right?
Yeah. I mean, the governor, I talk on a regular basis, and yeah, and I think that the governor's in a tough spot too, right? Not every community feels the same way as New Haven about how proactive we should be about tightening things up.
Okay. You know, we may even have this in the paper. I'm not sure, but I didn't know about the tree. Am I the only one?
I
The
don't think
tree
you're the
fell
only
and I
one.
didn't hear it, I guess.
No, it just happens to be on my window. Yeah, I don't know if anyone heard it. It's an interesting question.
All
Shana?
right. So you're looking for
Sorry, Mary, you have another question?
So you're looking for a new donor.
So, to be honest, we debated on whether to put out a call right now to see if someone would donate a tree, but we're not quite certain if we can turn that around very quickly.
Mhm.
And so we'll let folks know if we're looking for a new donor quite quickly, but we're looking for a new tree.
Okay.
It may not be the size and shape of the current tree. It might be quite smaller,
Okay.
but still inspirational. Shana?
Thanks, Mayor. I just wanted to follow up about the issues concerning Dr. Stephen Murphy with some of the testing billing that became quite the issue of controversy. I guess this can be directed at both you and Director Bond. Which site did Dr. Stephen Murphy administer? And for how long was this? If you can kind of run through how this kind of went down.
Sure. And correct me if I'm wrong, Director Bond. So Dr. Murphy reached out to us very early on in the pandemic. I think it was March.
Yep.
And when he reached out to me, I forwarded to several members of our staff. We contacted other places that he was doing testing at to get references, and they were quite pleased with the work he was doing. He then set up the first site at Chapel and Day Street in New Haven. And it was the first site that we had where people could actually walk up. All of the other sites were drive-ups at that point. And since that point, he tested at many different sites in New Haven. He did testing on the green. He did a lot of pop-up testing in different neighborhoods. He went into some of the nursing homes and did testing. He was very flexible with the testing. There were some, to our knowledge, other than the one case that was reported by the Independent that my understanding is Dr. Murphy addressed, there's been no one that has been charged anything for any test. And that's part of our contract with Dr. Murphy. However, there were some concerns about high insurance charges, the charges that Dr. Murphy levied on the insurance companies. And so a few weeks ago, we decided that it was because our testing capacity had expanded because of the support of federally qualified health centers in the hospital, in addition to some of the concerns about the insurance billing, that we would go in a different direction. And that's when we parted ways. You're on mute.
muted.
I always forget that, sorry. So tell me if you can kind of go into this. You mentioned about the charges, that there were no charges to these patients, but it was to the insurance, correct?
Correct.
Yeah, so they were if you were uninsured, you were not getting billed. So there were at least over 1,000 residents that had absolutely free testing if you had no insurance. If you had insurance, he would bill the insurance company the fees that he was charging. And so when the notifications are coming out about people being billed, it's really the insurance companies whom they are covered by being billed.
Have you investigated the billing practices following the New York Times report? Because I think he was also involved in some other towns as well as Greenwich, I believe, as well. Has there been any side investigation outside of that?
We have not had a testing site with Dr. Murphy for over 3 weeks. So we have not conducted any additional assessments. However, we did speak and previously when we were asking about medical practices and insurance billing, they were pretty standard to what he was charging for the level of work that he was doing. So and that conversation happened several months ago, where we just wanted to make sure and get a better understanding of where the billing concerns were coming from. And when we had a billing issue, it was the actual lab that charged the individual and not Dr. Murphy's practice. And that was rectified.
Just last question
Just
related to this.
To answer your question directly, we have not investigated any insurance billing. That would be between Dr. Murphy and the insurance company. If the insurance company were concerned about the bills that Dr. Murphy submitted to them, they could conduct an investigation. It is, however, and always has been very important that no one be charged for COVID testing, because we made that commitment. It's part of our agreement with Dr. Murphy.
I guess the final question to follow up, and I guess I'll be done after this. Moving forward, obviously, we're still in the middle of this pandemic. Testing is still a major concern to get people tested as frequently as possible if they do come into contact, whether they're essential workers or not. But I guess, what is the city doing to maybe prevent these kinds of concerns from happening, again, to protect residents from, any astronomical bills?
Yeah, I think that we moved away from Dr. Murphy, right? And I think that's one thing that we did proactively. And I don't feel like, at least I'm in a position to assess the appropriateness of insurance billing. That's a confusing thing, but there were enough concerns about it, and the numbers seemed high to me as a layperson, and so I think we made the right call moving in another direction. We're working with Yale New Haven Hospital, Fairhaven Health Center, Cornell Scott, who are all reputable long-term healthcare providers in the region that are mission-based. And to my knowledge, we've received no complaints about our billing or other issues with those three entities. And they have a relationship with the state who's providing the funding for their testing. They're doing the majority of the testing in the region. There's some other entities. Dr. Vasquez mentioned CHC, Community Health Center, and now Semaphore, that are starting to do work. We've also talked about Docs Urgent Care doing work in the region, and when we get a complaint, we'll follow up with it. For example, with Docs Urgent Care, they were not reporting information to the state. That was hugely problematic, and we pushed them and the state to fix that problem so we'd have a better idea of what's going on.
Thank you so much.
Yep. Other questions?
So you have Docs Urgent Care. That's also in New Haven? Is that?
No. So they have facilities in most of the surrounding towns, but not in New Haven.
Okay.
However, because we presume many New Haven residents go to areas in the surrounding towns, it was important for us to make sure that they were properly reporting data on New Haven residents.
Okay. And Community Health Center, are you talking about something different than the two qualified health centers?
So the state of Connecticut has a number of contracted community health centers across the state, along with Semaphore. And so we have a testing logistics team that is led by Dr. Vasquez, and the state participates, and when we have a gap where we want to expand testing on a weekend or an evening, additional partners are called upon to provide support. And so they are all approved through the contractual requirements under the governor's testing logistics office.
And just to, I don't know the answer to this. Community Health Center, is that a private entity or is that a nonprofit?
It's a federally qualified health center.
Okay.
It's just called CHC Inc. out of Middletown.
Thanks.
Okay. And then the clinics will have their regular hours, I guess, too, right? I mean, the Fairhaven and the Hill will continue to do that.
Correct. And they're looking to expand their hours. So as Dr. Vasquez mentioned, Cornell Scott is doing Tuesday and Thursday until 7 p.m. starting tomorrow. Fairhaven Health is also looking at doing potentially some weekend testing.
Right. Any problems with nursing homes, since that was such a big issue in the beginning?
Not at the moment, thankfully, but thank you for checking up. We are monitoring them on a weekly basis. They are back to doing point of surveillance testing every single week of their employees and their patients. So that it's really good news.
Okay. Anything to report on the homeless population? Any hotels have help with the state or where that is? I mean, if people are still in hotels?
Yeah, people are still in hotels, and we're looking to move more people off the streets and into hotels. We have a substantial commitment from the state on hotel rooms. I think we're pretty optimistic, and we're going to get to the number that we need to, that we would have over a normal, winter. It's just a matter of figuring out the staffing, especially with high community transmission of COVID that's impacted the staff as to be expected. So we're working through the logistics with our partners of getting the staffing set up. But I anticipate we'll have a model that's pretty heavily focused on hoteling versus any kind of congregate sheltering, just given the number of cases that we see, and that includes the warming centers. We're trying to move those into hotel rooms as well.
Okay. Any estimates on how much you need? How many rooms? I'm sorry. Any estimate on how many people you have to take care of?
Yeah, I don't have the numbers off the top of my head, but I can send those to you, because they're in different categories. There's the folks that will use that as emergency shelter, and those folks that will use it as a low barrier warming center, and those populations are distinct.
Right. Are there any shelters open? Any of the traditional shelters that we had before?
There are no longer any congregate shelters open. Everything's moved over to the hotels.
Right. Thank you.
Tom.
Thanks. I had one more. If you have any update about the Walmart on Fox and Boulevard, I'd heard that management might be in quarantine. I'm not sure if that's true. If you have, do you know is it open? Is management in quarantine? Is any staff in quarantine? Are they following their COVID safety plans from what you know?
Correct. It's a lot of it is still under investigation. They have been in compliance with submitting the corrective action plan along with the specific protocols that we requested. And we are still doing interviews in regards to the potential cases of employees and their return to work protocol assessment. So that's still on the way. To my knowledge, there is no management team person on quarantine.
All right. Anything else?
It's good to see you, Director Bond. I engage.
Thank
Hope you're
you.
well.